The Greater Columbus Infant Mortality Task Force came together because those of us in public health and in healthcare on our own weren't able to solve this problem. Part of the importance of this task force work is to raise broad awareness that we have a problem, we have a concern, we have a crisis, and there are ways for us to deal with it, but we all have to be aware of it and to be working together.
We are so program rich and system poor. I think once people become aware of the issue and they can see a role, we will start to build collaborative initiatives because we need to work together on this. There are lots of folks out there who've been working on this for some time. They need help, but they also need additional resources, and we need to work together in a coordinated fashion around this as opposed to working in our very capable and much needed silos.
So there's no doubt that having a nurse or having a home visitor who can come in and pay attention to what's going on, both listen directly to what's being said, but pay attention around the edges as well, can absolutely save lives. And I do believe that the opportunity to connect this mom and to connect others to other support systems that can help both in the short term and potentially in the longer term, will absolutely, and already does, address infant mortality in our community. But no doubt could be expanded, could be potentially better coordinated as a system, but there's no doubt that home visiting makes a big difference in the lives of families and obviously of moms and babies.
We could do so much more in Columbus, and we have to. You know, number one is housing. We have 20%, 25% of our moms we serve in Moms to Be, and right now we have maybe 100 moms in our Moms to Be program. 25% don't have stable housing. And housing is a huge priority for everybody, but we feel the pregnant woman should be the first priority.
Long term, if we want to improve Ohio, and if we want to eliminate the racial gap in birth outcomes, then we have to address both the clinical and non-clinical contributors to compromised birth outcomes.
Our 2020 goal is to, reduce infant mortality so that we're at or near the national average. But the part of that goal that I think is the most challenging is to cut the disparity of infant mortality between black babies and white babies in half. Right now, black babies, unfortunately, are dying at 2.5 times the rate of white babies. And a lot of that is driven by the 3 areas that we want to drill down on: prematurity, smoking cessation, and safe sleep. And so in getting to that goal, we have to really get at reducing infant mortality across the board, but to reduce that disparity. Without that, the numbers aren't going to change very much.